Today, the clinician will be assessing functionality of all 12 cranial nerves. First, the clinician will begin by assessing cranial nerve number 1 by asking the patient to close their eyes and smell a cup of coffee with both nostrils.
Hi Brianne, I'm the SLP graduate student doing some tests on you today, so just follow my lead. Okay, can you please close your eyes and let me know what this smells like?
Coffee.
Good.
The patient can smell the coffee with both nostrils, which indicates her olfactory nerve is intact. Next, the clinician will assess cranial nerve 2 by asking the patient to identify when they can see the clinician's finger. This will assess the patient's visual field.
Okay, so now I'm going to place my fingers on the side of you and just let me know when you can see my fingers.
I can see them.
Okay.
The patient is able to identify when she sees the clinician's finger at an appropriate lateral distance, indicating her visual field is normal. The clinician will then shine a light into each eye to assess the patient's pupillary response, which can assess both cranial nerve 2 and 3's function.
Okay, so now I'm just going to shine a light in your eye really quick.
The patient's pupils dilate and constrict in response to the light, indicating both optic and oculomotor nerves are intact with no evidence of disruption. Next, the clinician will be assessing function of cranial nerves 3, 4, and 6. The clinician will ask the patient to look in all directions without moving her head, following an object that is moved both horizontally and vertically across their visual fields.
Okay, now I want you to follow this object without moving your head. Great job.
The clinician will then ask the patient to fixate their vision on an object as it is moved toward and away from them at a point between their eyes.
Okay, so now I want you to stare at this object while it's moving towards you and away. Good job.
The patient is able to complete all of these tasks, which indicates there is no disruption to the oculomotor, trochlear, or abducens nerve. The clinician will then assess cranial nerve number 5, using a cotton swab to touch the forehead, cheek, and jawline of the patient. This will assess the patient is able to identify tactile sensation on their face.
Okay, now I want you to close your eyes and let me know where you feel this cotton swab.
The forehead, the chin, the cheek.
Good job.
The patient is able to feel the cotton swab, indicating there is no damage to the trigeminal nerve. The clinician will then test for a jaw jerk reflex to assess the muscles of mastication.
Okay, now I'm going to place my thumb on your finger, but don't worry, it will not hurt. Oh, good job.
The patient did not display the reflex, which suggests no damage to the trigeminal nerve. The clinician will then assess cranial nerve 7 by asking the patient to smile and raise their eyebrows.
Okay, now can you give me a big smile? Great. Can you raise your eyebrows for me? Good job.
The patient is able to do so with ease, indicating no damage to the facial nerve. Additionally, the clinician will use a cotton swab with lemon juice on it and apply it to the lateral sides of the tongue and ask if they can taste it.
Okay, now I'm going to place this cotton swab in your mouth and let me know what you taste.
Lemon.
The patient is able to identify the taste, indicating no damage to the facial nerve. The clinician will then assess cranial nerve 8 by rubbing their fingers next to each ear and asking the patient to stand on one leg.
Okay, if you can turn around, stand on one leg, and let me know if you hear this.
Yes.
The patient reported being able to hear the fingers being rubbed together and was able to stand on one leg, indicating no evidence of vestibular-cochlear damage. The clinician will assess cranial nerves 9 and 10 by testing the patient's gag reflex.
Okay, now I'm going to stick this back into your mouth.
The patient had a normal gag reflex, indicating no damage to the glossopharyngeal or vagus nerve. Throughout the evaluation, the clinician will be observing the patient's speech to identify if it is hoarse, slurred, breathy, nasal, or low or high-pitched. This will assess cranial nerves 5, 7, 9, 10, and 12. There is no evidence to suggest the patient has damage to any of these nerves based on their speech production. The clinician will ask the patient to shrug each shoulder individually and turn their head to the left and to the right, which will assess cranial nerve 11.
Okay, good job, Brianne. So now I want you to do as I'm doing. So raise your right shoulder. Good job. Now raise your left shoulder. Okay, now look to your right. Now look to your left. Good job.
The patient is unable to shrug her right shoulder and cannot turn her head to the left. This may indicate the patient has damage to the right accessory nerve. Lastly, the clinician will assess cranial nerve 12 by asking the client to stick their tongue out, move it from side to side, and push forcefully against the inside of their cheek.
Okay, last thing. Now I want you to stick your tongue out. Good. Now move it from one side to the other. Good. Now push your tongue into your cheek. Good. Now the other cheek. Good job.
The patient is able to complete all of these tasks within normal limits, which indicates no damage to the hypoglossal nerve.